Dr. Wilson, what is a traumatic brain injury?
Well, a traumatic brain injury is any blow to the head that's hard enough to affect the brain.
What can cause a traumatic brain injury?
Well, as you can imagine, the variety of things that can cause damage to the skull are almost limitless. The commonest things we see are falls and sports-related injuries. But anything that hits the head hard enough can cause a traumatic brain injury.
What are the symptoms of a traumatic brain injury?
The original symptoms, of course, loss of consciousness, loss of memory, those are things that happen at the immediate time. And then later on, headaches, dizziness, fatigue, irritability, those are symptoms that happen later or often shortly after the injury itself. You're going to have loss of memory, ringing in the ears, blurry vision, noise and light sensitivity, and rarely decreases in taste and smell.
What is the treatment for traumatic brain injury?
The primary treatment is rest. We have our athletes stay out of school until their symptoms are improved. That's the number one thing to do. In addition, you can do physical therapy. We do have a physical therapy program that treats specifically brain-injured people. Also use all sorts of occupational therapy, speech therapy, and even psychiatric counseling for people with head injuries.
How long does it take to recover from a traumatic brain injury?
Typically 2 to 3 weeks to recover. However, there's a phenomenon called the post-concussion syndrome that may last several months to even years. Usually, even with those people, their symptoms show up within the first 7 to 10 days and are resolved by 3 months. But those symptoms can be just like the ones I mentioned before, and they seem to not have much relationship to the degree of injury the person suffers. In other words, how hard the head bump is doesn't correlate directly with who's going to get post-concussion syndrome.